It's February, and you know what that means. Well, maybe you don't. It means a few things, actually. But one of the things it means, it's American Heart Month. And so I'm wearing red to support everyone who has issues with heart disease. And a touch of love is in the air, too, because after all, it's the month of Valentine's Day. But here's the question. Are you taking care of your heart? There's a lot of things we have no control over, but there's a lot of things we can control. So stay tuned, because my guest today is going to talk all about taking good care of your heart. Hey, good morning, everyone, and welcome to Scan FYI. So it's February, it's the month of love, and it's the month of hearts. And today we're really focusing on our heart. It's American Heart Month. And my guest today is Carol Brush. Hi, Carol.
Hi.
All right, well, it's good to see you during this month of hearts and love. So now you are from Braven Health, and would you kindly introduce yourself and just tell our audience a little bit about you and what you do?
Yes, absolutely. Hi, everyone. My name is Carol Brush, and I am one of the health educators for Braven Health. And what we do there is we promote wellness. And hopefully, by promoting wellness, we also want to establish behavior change. And that's the most important piece, I think, about health education. So that's what we do for Braven Health.
The hardest thing, too, changing our habits, right?
Correct.
But I think it's fair to say for everyone, it's a lot easier to do things that are going to keep yourself healthy than to get sick and then you have to get yourself cured. So we want to focus on some of the things we can do to stay healthy. Now, heart disease, I know this, is the number one cause of death in the United States. And I feel like that has not changed in many, many years.
Mm-hmm. Yes, and that's absolutely true. Unfortunately, it isn't. And I think there's a misconception that a lot of people have. They think that it's not going to happen to them. So I believe that that's one of the misconceptions. And unfortunately, there are many forms of heart disease in this country.
Yeah, well, I think the idea that it's not going to happen to me covers a lot of territory. But definitely heart disease. So when we talk about heart disease, obviously that's a big umbrella, covers a lot of different things. You want to kind of give us a little bit of an overview of what are we talking about when we say heart disease?
Absolutely. And that's a great question. So the most common cause of heart disease is the narrowing or the blockage of the coronary arteries. I think a lot of people don't understand when they think about the heart, right? It's a muscle and they think about the whole heart, but it's actually those little arteries that get blocked. And those blood vessels are extremely important for blood flow, right? So, which is what happens when you don't take care of that. There's a situation of buildup of plaque. I know everyone's have heard of plaque, right? And on the walls of the coronary arteries over time, right? This condition is obviously called the coronary artery disease. So this is the major reason why people have heart attacks.
Right. And, not too long ago, actually, just a few weeks ago, just coincidentally, Carol, we spoke to a cardiologist and we talked about, we had a lot of snow. We talked about the dangers of shoveling snow and that it can be very stressful on your heart. So again, a lot of people are in denial. You think, well, it'll never happen to me, but don't shovel snow unless you know that you are in very good shape and your doctor has approved it. Okay, so we talk a lot about risk factors, and look, we can only change so many things about ourselves. So maybe you could talk a little bit about risk factors.
Correct, and that's something that's very important too. So the number one risk factor, unfortunately, is age. So as we age, the heart muscle may not relax between beats as easily, and as a result, the pumping of all those chambers becomes stiffer, okay? And it could work less effectively. So that's why we always promote, and like you said, being healthy, right? Physically active. So over time, if you're not, those relaxations between the beats gets a little bit harder. And we can't change our age, right? and that's the
Yeah.
beauty of life. Number two is gender. So women's hearts tend to beat a little faster, and men's hearts tend to be a little larger. So as you age, your arteries will naturally harden and become elastic over time. And in general, most elderly people have a moderate increase in blood pressure. So that's why a lot of cardiologists says, oh, you know what, most of my patients, you know, they do have high blood pressure, and we need to control that blood pressure. Okay. Number three would be family history. So women with the first degree blood relative, parents, or siblings who had coronary heart disease or stroke before 65, you're at higher risk. And the last is ethnicity. So African Americans and Asians have higher risks for developing heart disease than any other group in the United States.
So these are the things we cannot change.
Correct.
Yeah. But there's really good news, because there are a lot of things we can change and have control over our destiny to a point. And that's the good news. So that's what we have to really focus on, because can't change the fact that I'm a woman. I can't change my age. Even though in my family, I don't have any situations of heart disease, I'm not so naive to think it could not happen. You know, we can't be in denial. So Carol, talk about what you can change. How can you lessen your risk?
Right. And this is, I think, the most exciting piece. And what we try to do is promote all of these behavior changes, especially those nutritional aspects of it. Right. So we always promote healthy eating. And I think that that's the most difficult piece, whether it's cultural related, whether it's our lifestyle change, because as we grow older, we tend to stop doing the things that we used to do, especially cooking, right? So we tend to stop cooking in our homes and we go out more. So what we try to advocate is choosing healthy dishes, choosing a variety of different foods, right? But we're going to focus on those cholesterol and the triglycerides, because that's really, really where all of the bad cholesterol comes from. Right. So our body makes several different forms of cholesterol already, but the added cholesterol that we put into our bodies is extremely important.
So I guess, you know, if you're listening and you are guilty, I guess that's the word, and we all are at certain times of following a kind of an unhealthy diet. You know, what do we say? The journey of 1,000 miles starts with a single step. So you can carefully and selectively make some little changes to your diet, and you do this continuously. Before you know it, you will be on a path to better health. Your doctor will be very happy too, I would think. Yeah.
Absolutely. Mm-hmm.
Now, do you want to mention anything about tobacco and alcohol?
Absolutely. Nowadays, there's a tremendous amount of different tobacco, like vaping, and there just seem to be really geared to younger population. But I know a lot of older adults too that think that vaping is a great alternative to stop smoking, but it really isn't. So smoking, and a lot of people now, since the pandemic, their stress, their mental health, tobacco use has risen. So I'm hoping that everybody realizes that tobacco use decreases those healthy HDL cholesterol levels, okay? And they increase the lousy LDL cholesterol levels in the blood. So that's something that you should keep in mind. And if you want to stop smoking, there's opportunities that you can. And I hope that everybody realizes that there is a direct effect on your heart when you do smoke.
Well, I had heard, of course, we've all known that during this whole last 2 years of, pandemic life, that people have been drinking more, but I didn't realize people have been smoking more as well. But I guess it kind of makes sense,
Absolutely. So old habits became new habits again.
Right. And, last but not least, you did mention stress, and, stress is a big factor in your health. And if you are a person under great stress, we have to learn how to manage that stress, take care of ourselves, because stress can do terrible things.
Absolutely. And just going back on the tobacco and alcohol use, drinking too much, again, not only is there more consumption of calories, and especially if you're not exercising, right? What happens is it turns into fat, and all of those, and it also raises those triglycerides. So when you get a report and your doctor sees, or your cardiologist sees, that your triglycerides are high, they know exactly what you're putting into your body. So they know whether you're drinking more, whether you're eating more processed foods or boxed products, or going out to restaurants more. They realize that that's the case. And last but not least, yes, certainly stress is the most important. I think a lot of people are unaware of how just the fact of being angry or being anxious, there is a direct link to your heart. And unfortunately, when you are stressed, your blood pressure raises, your cortisol levels raise, and all of those, and all of those are direct effects of your heart. So we need to learn ways to de-stress and realize that our mental health, is a big component of our overall health as well. It's not separate anymore.
I think a lot of people aren't realizing necessarily that your mental health is going to affect your physical health. So, it'll holistically, we're all one. And you have to take care of when everything you do good for your body, it's good for your brain, it's good for your heart. And whatever you do that's not good for your body, and often we know it, it's not good for your brain, it's not good for your heart. Old habits are very hard to break. And I have to agree that during these last few years with the pandemic, a lot of people have reverted, unfortunately, to a lot of bad habits. And I think a lot of it is it's a stress reaction. I mean, come on, we've all been there. So
I agree wholeheartedly. But unfortunately, those are the tools that we never were accustomed to, right? We were never taught. So don't blame yourself. And, so we have newer tools that we can depend on. So those newer tools now are exercising, meditation, yoga, stretching even, taking a walk. So you don't have to necessarily, join a gym. You can do all these things in the comfort of your home, and we have those abilities now, right? And then everybody found a new love of walking when the pandemic hit. So I wholeheartedly think that all of those things are very important, and just moving is extremely important when we age.
So what are some of the specific screenings, we'll call it, or lifestyle changes that we might want to make or work on getting towards that will be especially good to our heart?
Absolutely. And they're easy ones. And I know everyone has had the experience when they do their annual wellness exam, and that is the most important. Also, I just want to reiterate that in regards to the annual wellness check or the annual physical beforehand, everyone always gets from their whether they're a Braven Health member or Horizon Blue Cross Blue Shield member, you always get a mailing, and that mailing is a risk assessment. Now, and I know, because I've seen it even with my family members, that risk assessment is extremely important, because that lets not only your insurance company know who you are, what you're suffering from, but it makes things easier for a smooth transition and communication with your doctors and your specialists as well. So I want to emphasize that. And not only that wellness exam is so crucial, is one of the biggest reasons is because that communication with your provider in the beginning, and you're getting and all of those tests that are very important. So they'll talk to you about healthy diets, right? They're not registered dietitians, so don't think your doctor is going to, give you a diet or go into depth, because they're not trained to do that. But if you want to, you can always go to a registered dietitian and get help there. That's number one. Number two is your BMI. Your BMI tells the doctor a lot of things about you, and you set goals, whether it's maintaining weight or losing weight. BMI is a screening tool that is national in our country. So that is very important screening that everybody should have yearly and talk about with their provider. Okay. Obviously, your blood pressure, whether you have high blood pressure, those goals need to be spoken, whether they're happy with your numbers and whether they want you to decrease them. Okay, right. So that's another screening. Okay, and another great screening is your glucose level, right? So sugar. We all know sugar, absolutely. So uncontrolled sugar, uncontrolled diabetes just makes the heart work harder. And unfortunately, diabetes damages those arteries, those vessels that I talked about before. So those are the specific screenings that physicians use.
So, I have to say that when you're on Medicare, of course, you're entitled to a wellness screening, whatever your Medicare plan is. And really, shame on you if you don't take advantage of it. You just owe it to yourself. The whole point here today is if you're good to your heart, you're good to yourself. And I see that too many people they're just not good they're not kind to themselves.
And I agree with you. I think we take a lot for granted sometimes, and that's a great point. I think a lot of us think, I have health insurance, I'm okay, but realizing and focusing on those preventative screenings is extremely important. And you're right, a lot of people do not use their benefit. They don't. And that's a message that I want to get clear for today. I think using your benefits and using that time and energy that you can take for yourself and asking those important questions and checking off all of those important screenings that are preventative for you.
Because, this is something that no one else can do for you. You have to go to the doctor. You have to establish the lines of communications. And I think ultimately a learning lesson for all of us is, we have to we're responsible for our own health. So we owe it to ourselves. Again, it's American Heart Month, and we want to raise awareness that there is a lot you can do, and you need to do it. Come on, guys, just do it. Whoever your insurance company is, make sure you have your annual wellness checkup and just start working on being good to yourself. Remember, it's also the month of love, and we have to love ourselves. Got it? Okay. So Carol Brush from Braven Health, thank you so much for being my guest today.
You're so welcome. Thank you for having me. And thank you for this great opportunity to spread and promote wellness. I wish you all well. And please keep your hearts healthy and keep moving.
Love yourself and love your heart. I'm Andrea Tarr. We'll see you next time on Scan FYI. Bye, everyone. Bye, Carol.
Bye.